Simon and Garfunkel, The Sound of Silence. It's 20 to 3. Still to come today, we're going to be chatting to the boys from G4. They're going to be coming to the Hippodrome in Eastbourne soon. Now, though, we're talking about magnets. Not the kind you buy on holiday and then stick on your fridge. No. We're talking about magnet therapy. Does it work? Is it something that you have benefited from in the past? Have you bought one of those bracelets? That's how you tend to see, isn't it? People wearing those magnetic bracelets. Is it just a placebo? Well, that is the question I put to Alan Cook and Anthony Rook, who have a company that does just that, magnet therapy. Now, it's interesting. You know, we were talking earlier on today about stereotypes. Now, if I were to say to you, what would you imagine somebody who's advocating magnet therapy to be like? When you think about alternative medicine, alternative therapies, put it this way, Alan Cook and Anthony Rook do not fit that description.
Bracelets generally are worn for well-being, or if people have got arthritic joints and that type of thing. But there's many more areas that magnet therapy can be used for, and it's all over the body really. There's a product that can help most ailments.
So what's the science behind it?
Well, basically what is believed is when a magnet is placed on the body, a dual reaction occurs. Firstly, the tissue lengthens. That in turn brings more oxygen to the area. And when you've got a trauma, you've got excess acid in the area. So like all complementary therapies, this takes away excess acid, brings more alkaline into the area, and therefore balances the body. I mean, it's a little bit more involved than that, but that in simplistic terms is what...
You say that is what you believe, and obviously you do, but there will be people, there always is, whenever you talk about any sort of alternative therapy, who poo-poo the idea of it and say, what are you talking about? How can a magnet actually do something like that? What you need is medicine, what you need is drugs.
Well, absolutely, there are people like that, and believe it or not, I was one of them. I got into it, it was quite a long story, but I got into it from looking at a bracelet on a shopping channel, and I was hearing people saying that it could reduce high blood pressure, which I didn't really believe at the time, but I thought, well, I've got nothing to lose, so I tried it, and because I monitored my own blood pressure at home, I was able to see the results of it quite quickly, and something actually happened. Then when I took the bracelet off, my blood pressure went back up again. So that's how a skeptic really myself got into it. And as you'll probably hear in a few minutes from Anthony's point of view, he's done a lot of work with the animals side of things, which is very fascinating, because a lot of people will turn around and say, yes, it's placebo, you know, if you believe it's going to work for you, it will. But we know in animals there's not really a placebo there.
So how does it work then for animals, Anthony?
Well, it's very interesting. I mean, it's an area that we're studying, and personally for me, I feel that animals are the perfect test subjects when we deal with magnets, because, as we've mentioned, placebo is something that skeptics use as an argument against it. But when we bring animals into the equation, it's bit more difficult to argue that notion.
Because they might not be aware that they're
precisely.
wearing it. Well, what do they wear? I mean, in humans we're talking about bracelets, but how would you do magnet therapy on a dog, for example?
We've got a variety of products. We do pet collars for cats and dogs, and we've got, I mean, really, we've got a product called the Magnasage that can be used on animals. It's a pulsed-electrical device, massage device. And really, as I said, placebo is something that I don't believe you can gauge out of an animal, because you cannot put a magnetic product on an animal, on a cat or a dog that's got some sort of ailment, and say, right, this is going to help you, this is going to work, I'm going to put this on you, and you're going to feel better. If you do that and you see results, that animal's not going to know that it's that product that's helping.
What sort of ailments then can you treat in animals?
Arthritis, you can hip dysplasia with dogs, any sort of canine ailment, physical ailment, There's a whole variety of various problems that can be treated with magnetic therapy for animals.
Is there not a worry, and talking with animals, but humans as well, if you put your faith in this kind of thing, magnet therapy, or any sort of alternative therapy, that actually you're kind of then not going down the more traditional route and therefore missing out on something that actually could really help?
Not really. A lot of people that come to me have tried drugs anyway, prescribed by their GP, and they'll say, I don't want to put any more drugs in my body, it's not doing me any good, I want to look down the alternative route. Can I just say as well, Alison, that you cannot put any old magnet on the body. If you get a fridge magnet, it's not going to... but just so that people know, it has to be...
Leave your fridge magnets where they are. They are not going to help you.
Absolutely. It's all about the Gauss rating of the magnet, and therapeutic magnets have to have a particular rating of Gauss. It's a little bit, to simplify, it's a little bit like an electric light bulb. If you put a very low wattage electric light bulb in your lounge, you're not going to have sufficient light. And if you put a very low Gauss rating magnet on your body, it's not going to do anything whatsoever. So the Gauss ratings, and any reputable manufacturer or seller will be able to give you the Gauss ratings, and if they can't, and they should be up around about the 1,000 upwards for healing purposes, then I would stay well clear.
Okay, because people do worry when they go down the kind of alternative route. You've got to make sure the person you're dealing with, as you say, is reputable, that they know what they're doing. What do doctors think about magnet therapy?
We have a mixed reaction, because a lot of doctors have only been trained, in the drug side of it. We've found that a lot of the older doctors are very set in their ways, but younger doctors tend to be quite appreciative of it, those have actually looked at it. We've got a testimony on our site from an actual doctor who is in the private healthcare, in the Nuffield healthcare system, about our pulsed electrical magnetic device that he's had on trial, and he's raving about it. And to try and get a testimony from a doctor, as you could probably appreciate, they don't give them out willy-nilly. So that is encouraging from our point of view anyway.
Are there any side effects? Because we've all had it where you leave the doctors, you've got your prescription, you go and get the medicine, and then you read the leaflet and you think, hang on a minute, well, look at all these side effects. I don't know if it's even worth taking it. Anything like that with magnet therapy? Any negatives?
There is very little. Over the years, I've found that they're safe and effective. They're relatively affordable, it's reusable, there's so many benefits to it. Talking of side effects, the one thing that I found with a friend of mine is, if they've got a real problem and it's very deep rooted, we have known the issue to get worse before it gets better. That, I would say, is not the norm. It will normally improve quite quickly. But if that is the case, then we say to people, look, if it does start to deteriorate or get worse, or you feel more pain, then take the device off and reintroduce it for a shorter period. Because basically there is no time limit. You have to listen to your body. You put a magnetic belt on your body, maybe on your back, because you've got back pain, and you have to listen to your body to see how it works. Everybody reacts differently.
Alan Cook and Anthony Rook talking about magnet therapy. Great, aren't they? But nothing like I thought they would be. I suppose because we kind of fall into that trap, don't we, of thinking in stereotypes, thinking of alternative medicines or magnet therapy advocate. Whereas these two used to work together at Gatwick Airport with the luggage trolleys. In fact, we'll hear more about that after this. Dancing in the Dark. This afternoon, we're discussing magnet therapy. Does it work? Has it worked for you? Marianne's got in touch to say, from experience, I totally agree that a magnetic collar on a dog with arthritis works. I wonder if it could help with the dog's ear infection. We're hearing this afternoon from Alan Cook and Anthony Rook all about magnet therapy and the ailments that it could benefit.
Yeah, mainly arthritic joints is the main one, and severe back pain. The pulsed electrical magnetic frequency, which we do, which is shaped like a torch and throws a magnetic field from the cap into the body, you only need sort of a treatment for about 5 minutes with that. That'll do in 5 minutes what static magnets will take 24 hours to achieve at least. So a lot of people are going down the pulsed electrical magnetic route now, and you'll see a lot of sort of research has been done. They're looking at cranial stuff for the head, you might have seen. That again is helping a lot of people with headaches and migraines. So it's coming forward a bit, and it is starting to catch on. I mean, this has been in America and Russia and everywhere for many, many years, and we've sort of lagged behind. The biggest problem is trying to get the word out.
Have you benefited from magnet therapy, Anthony?
I absolutely have, yeah. In fact, it was Alan that introduced me to magnets because I've suffered from quite a bad shoulder injury, and Alan suggested that I try magnetic therapy, which I did, and it helped me immensely. Actually, going on to I know we spoke about side effects. One of the things that I felt when I used magnetic therapy, I was using the little Neo discs on my shoulder, and I felt tingling sensation and itchy sensation. And after I'd taken the magnets off, my shoulder was, well, it felt great. The pain had been reduced significantly. So I've first-hand experience of using magnets, and that's essentially what converted me and got me involved within magnets. Because I tried it, it worked for me, and I felt that this was an area that needed to be expanded and needs to be put out there a bit more.
Can I just say as well, just to add to that, that it is important for people who do use magnet therapy to drink plenty of water. That flushes the toxins from out of the system a lot more efficiently than if you just left it, or you drink your caffeine or whatever. I'm not saying don't have coffee, but in general, the more water you can flush through your system, the more those toxins will be removed.
You were mentioned before that you two met when you were working at Gatwick Airport. What did you do at the airport?
We were part of a trolley team, which is a physical job, which moving long lines of trolleys around the airport.
Wow, so you know all about backache.
It's absolutely what, I'm pretty sure that, the physical problems that I was getting from the job, and the magnets obviously helped immensely.
What did your colleagues think when you started to talk about magnet therapy? I tell you why I ask, because I think whenever we talk about alternative medicine, alternative practice on the programme, people tend to fit a kind of stereotype, if you know what I mean. I hope you don't take offence for what I'm about to say.
No, but I know exactly where you're coming from.
Yeah,
yes.
And the people who come in, who advocate it, tend to be a little bit hippy-dippy. I'm talking long flowing skirts, very zen. And then you two come in, geezers talking about magnet therapy. I'm just wondering, how did that go down with your colleagues? Were they quite surprised?
It's a mixed bag, really. Sometimes you get a mixed reaction. Sometimes you do get people that poo-poo instantly and say, nah, not interested. And then you get others that show an interest. And funnily enough, a lot of our former colleagues, we managed to convert them and did try magnets and found they were beneficial to them, particularly in a physical role that they were doing.
If people want to find out more, how can they do that, Alan?
Yes, they can visit our website, which is www. And then it's Norstar, we're spelling that Norstar, magnetics.com, or they can call for further information on 01403 251 733. And we're not necessarily after just selling people products. We're quite happy to talk through their ailments. I'm a qualified magnetherapist, so hopefully I can help them or give them advice along the way to whatever they're trying to achieve.
That's brilliant. Thank you so much. Been lovely meeting you both. Alan Cook and Anthony Wood. So magnet therapy, does it work, or is it simply a placebo? You can let me know what you think. Text 81333, start your message with the word radio.